Welcome, everyone. My name is Erin Downard, and I am a licensed audiologist. I've been in the hearing care industry for 7 years in a variety of settings. I currently serve as the Director of Provider Engagement at TruHearing. Today, we've invited a panel of hearing care experts to discuss the integral role they play in their patients' hearing healthcare journey. Our discussions will be centered around the impact untreated hearing loss can have on a person's health and well-being, some of the barriers which prevent people with hearing loss from seeking help, and to share some positive results people have experienced by wearing hearing aids. Before we begin, I'd like to thank each of our providers for joining us today and invite each of them to introduce themselves. Tell us a little bit about where you work, how long you've been a hearing care provider, and where you practice. So, Michael, we will start with you.
Hi, I'm Michael. Work in the greater Boston area. I've been practicing since 1991, and I'm an audiologist and private practice.
I'm Amanda Gill. I'm a hearing instrument specialist. I am the owner of Hearing Center of Andover in Andover, Minnesota, and I have been practicing for 15 years.
My name is Kathryn Little, and I'm an audiologist in Kokomo, Indiana. I'm the practice manager for John Weaver Audiology, and I have been practicing for over 30 years.
As you can see, we have an excellent panel joining us with a wealth of knowledge and experience we will tap into today. TruHearing is very proud of our provider network and the hearing care providers. TruHearing only partners with providers who meet high quality standards in their practices and through patient care. Each provider is required to go through a credentialing process prior to being accepted into our network and must be recredentialed every 3 years. Additionally, providers must adhere to the clinic and patient standards TruHearing has in place to ensure the best patient experience and outcomes, which may be in addition to the standards they already have in place in their own clinics. As providers, how important do you feel these standards are to your patients and your practice? And what impact does that have on the patient experience? Amanda, we'll kick it off with you.
Well, I think just in general, we all have our own professional, standards that our ethics are, we try and keep a higher standard of care for our patients. I think because we all want to have a good outcome and a good first experience. Just like when I, was joining with TruHearing and I was reading in their handbook about the delighted experience and the delighted patient. We all, I think, as providers and professionals, we want that. We don't want them to have that bad experience and to leave and not be able to help them. I think we all just really care about what we do and the people that we serve on a daily basis. Everybody's somebody's grandmother, somebody's mother. And I think we all keep that in mind, when we're serving these people day in and day out and trying to help them and their families and their loved ones. So I think that's really an important part, for all of us, for their, first experiences with us as providers.
Very well said, Michael.
Well, I think a lot about the patient journey, and I'm thinking from the patient's perspective, how I'm thinking about getting a hearing aid for the first time and how many different choices there are, where to go, what professionals to see. This industry as a delivery system is a little bit fragmented in that you can get something online, you can get something at CVS, you could get something from a hearing instrument dispenser, you could go to an audiologist, you could go to a hospital. There's so many choices. The one thing that I really think has a lot of value is that most people start by calling their health insurance company and saying, where should I go? And they are directed towards TruHearing. And for me, then they're directed to me. That gives me an inherent level of trust with the patient. The patient sees me as recommended by their insurance provider. And I believe that sets them at ease. I think that gives them a level of comfort that they may not have otherwise. And so for me, that is a sort of an added value to know that my patients are coming in feeling pretty relaxed and confident that they're seeing somebody who has been credentialed by TruHearing and they're going to be given a high level of care.
Absolutely. Kathryn, anything to add?
And I can't really add much other than I think another thing that's important to the patient experience is their experience when they call into TruHearing. And what I've heard from the patients back is, oh, I spoke to this person, they were so kind, or, I called them or they called me. And I think just as important is the experience that they have when dealing with the company itself. And that always seems to be positive.
Thank you all for sharing. Yeah, very well said. Right, we're going to move on to question 2. Untreated hearing loss can have a negative impact on one's physical and mental health and overall well-being. Research has shown that untreated hearing loss contributes to social isolation and depression, can impact relationships, and lead to a higher risk of cognitive decline, falls, and health conditions. In your experience, how has hearing loss impacted the quality of life for patients that you've seen? What are some of the physical, emotional, or mental impacts that you've seen in clinic? Kathryn, we'll start with you.
I think this is a topic that a lot of people are hearing, even from their family physicians. So, in mentioning this, I've heard a lot of patients, when they come in for their appointments, talk about this and bring it up. So, I think there's a heightened awareness about the issue of untreated hearing loss and where it affects a communication status for a patient. So, I think they're coming in almost kind of like asking for more details on how I can prevent this moving forward. So I see a lot more willingness and a lot more openness to the idea of trying amplification because number one, we have done such a good job along with the manufacturers of, making this as simple as putting on your glasses. And I think more people are seeing it in that manner, that this is just part of the path and part of the journey, and I don't want to miss anything. And so I'm ready to jump on board. So
Absolutely. Amanda.
I think too, a lot more, I think with all the information out there, a lot more families I see a lot more children getting involved with their parents or, grandmother, granddaughters bringing in their grandfather. Um, you know, it affects everybody's health. I mean, not just the patients themselves. I mean, it's their family too that, I had a daughter, bring in her mother today who has cognitive decline and has early stages dementia with concern. So I think it's just not, we're their counselors. We're trying to help them along the way. We're, just, I see it all the time with, wanting to hear their grandkids better. I mean, a gentleman yesterday was in with his wife. The sole purpose of her being there was to be able to hear her voice. Nobody else's, just hers. So there is a lot of things out there. I think that, like Kathryn said, I mean, manufacturers and studies getting out there and promoting the health and well-being of just that, the population, just how much untreated hearing loss there is. So yeah, it very much so. I think it has a lot of impact on mental and cognitive, decline and things like that.
Yeah, very well said. The patient and their loved ones. Absolutely. Michael.
Yeah, so I think what I see is that people definitely talk to me about participating less in some of the things that they really like to do, family gatherings that are difficult to be involved in, having just a lot of anxiety over these situations before they go to them because they know they're going to have difficulty, or just avoiding them altogether. So I think also I get a lot of information from family members that I have present that tell me how the patient is reacting during these types of situations, that they may withdraw, they may not join in all the different activities that they normally do. So that to me leads right into isolation and depression and all the different things that the studies talk about. I see it on a daily basis, so I can attest to the fact that it is real.
Yes. Again, I always like to point out that overarching theme is family members and loved ones. The patient is first and foremost at the top of our minds, but we affect so many more people typically with the hearing aids and the help we provide. We'll move on to question 3. As hearing care providers, you're aware that on average, people with hearing loss wait 10 years to get hearing aids after becoming aware of their loss. What do you see in your practice as the primary concerns or obstacles preventing people with hearing loss from getting help? And secondly, how have you helped them overcome those concerns or obstacles? Amanda.
I think that just the stigma is still there with hearing aids. I know it's posted all over line, like the size of hearing aids, but not everybody sees that with certain age groups. I mean, they still have that stigma that there's maybe a large big thing and it whistles, and I heard it yesterday. It's not going to whistle, right? I'm not going to have this big thing on my ear whistling, and I'm like, no. And they see it and they're like, oh wow, that's a lot smaller than what I am used to. Cost, that's obviously one of the biggest concerns, the cost. Maybe they don't realize they have a benefit for hearing aids. I mean, just not getting all the information, and just maybe other people's experiences. And they're just, it's the age of information. So we got all this information, and I think it's just overcoming some of these obstacles when they come in and see us.
Kathryn.
I would agree with what she said. I think a lot of it has to do with fear of the cost and also fear of the unknown. And once the patient comes in and you can kind of sit down and explain everything to them and kind of quell those fears about, it's going to be out of my price range, or it's something that I'm going to get and I'm not going to enjoy it once I make this investment, or why can't I have the thing that they sell at Walmart? Why is that not as good as what you're selling? And you have to kind of go through all of those things one at a time. But I think people today are much more open. Amanda, you seem a lot younger than me, and Michael, you and I might be in the same era. But I think people today are much more open than they were 10 or 15 years ago. I think that it's becoming, a more accepted, just happening in your life. So from that standpoint, I feel like I have to do less, kind of encouraging than I did several years ago. I think people are more open in general.
I would agree. Yes.
Yeah.
Than 15 years ago doing this, starting. Yes, I would agree. It's a lot easier.
Still an uphill battle, but maybe more of a,
Yeah,
a slight.
it's not as difficult as a climb. Yeah.
Right.
It's leveling out a little bit.
Yeah.
Michael, wrap us up.
Sure. I think it's hard to admit you're getting older, and putting on a pair of glasses for some people, putting on a pair of hearing aids, walking with a cane. All these things say, all right, we're getting older, and people don't really like to admit that in some situations, in some cases. So that is definitely something that I think people have trouble getting over. But I think that one of the things, the second part of the question was, what can you do to help people get over those obstacles? One thing that I find extremely helpful is um, putting a demo on somebody and let them
Mhm.
feel what it feels like to have it on their ear. I show them what it looks like in the mirror. In fact, if I have test results, I'll program them and let them see what they sound like. And for a lot of people, they say, wow, I didn't expect it to be so comfortable or sound so good or be so not noticeable. And that's actually very helpful. And lastly, I do get a lot of feedback from people. My friends told me, their hearing aids were no good. And so I do spend time talking to people about the difference between, your hearing loss versus somebody else's, and someone else's experience could easily not be the same as yours. So 60-day trial period gives you the chance to try it. Tell me what your experience is like after the first 2 weeks when you come in for your checkup, right? So make your own decision, formulate your own opinion, and there's not a lot of risk involved, and it's really quite an easy process. So that is, I think, having a 60-day trial period in place, using a set of demos are a couple of the things that I do to bring people over those obstacles.
Great. I think you three pretty much summarized the day-to-day complaints,
Yes.
concerns that we see as providers. In this day and age, what are patients asking for? What do they expect from their hearing care and hearing aids? And how do you help meet those expectations? Michael, let's go ahead and start with you.
Yeah, so I think people are very interested in connectivity. They love the gadgetry. They want to know about how they can adjust their hearing aids with an app. And I think that you have to be really well versed in all the different technologies and be able to explain it properly and in a very simple way. I think that also today we have probably our most educated consumers. A lot of times they come in, saying, I want to have this feature, I want to have that feature, I heard this about that manufacturer, and they really know a lot. Some people come in saying, this is what I want. So I think that just being an expert in every area of the technology, being able to explain all the different features, knowing the difference between the 2 or 3 or 4 technology levels a manufacturer offers. I think that if you can explain that in a simple and clear way, that is a big help for you.
Kathryn.
I agree with Michael. I think people are looking for not just amplification, but a way to make that fit into their lives and something that they can really make benefit of in a variety of situations. I also think people are more open-minded about trying accessories, TV streamers. I had a patient a few weeks ago who was having trouble in Sunday school. So we, set him up with a remote mic and he's just thrilled to death. So I think once they get over the idea of, the technology of the devices themselves, then they're more willing to leap in and try other things that might help them in their daily life. So
Yeah, and I'll agree with Michael and Catherine on those things. I mean, it's very much a informed consumer market. And it's as providers, I mean, it's really important for us to keep up with the technology levels and the changes and, continuing education. So we are able to, help meet everybody's needs and, introduce all these different solutions for everybody. I mean, my own mother, I just got her a TV streamer. And as soon as I got it and hooked it up at her house, I got a text message within, like, I left and I went home and she was like, thank you, thank you, thank you. This is the first time I've heard every single word on a TV program ever in the last, I mean, I put hearing aids on her 13, 14 years ago. So yeah, she was like over the moon that she could have that kind of, you know, technology. And sometimes I don't think they expect all the solutions we have either. They might be really informed, but it's also our job to be more informed even so that we can get them this help that they need. For sure.
Yeah, my
100%.
sister-in-law thinks I'm a rock star because my brother-in-law now listens to the TV at a level that she can tolerate. I got the big thank you, thank you, thank you, high five from my sister-in-law recently. She was like, oh, marriage saver.
Oh,
So,
yes.
Yes, we get a lot of comments like that, don't we? And Amanda, like you said, knowing the tech, and I believe Mike, you all mentioned it, knowing the technology ourselves too, every patient might not need every aspect. You might not ever go down that road, but it's important for us as providers to know that so that you can implement those when necessary. Absolutely.
Yeah.
All right, we will move into our last question, 5. TruHearing plays a key role in the positive outcomes we hear from our customers. By working together, we can improve the lives of people with hearing loss through affordable hearing care solutions that incorporate the latest innovative hearing technology with excellent provider care. How has being a true hearing provider made a difference for you and your business? And how important do you feel affordable hearing healthcare is to patients? Kathryn, I'll let you kick us off.
So I live in the Bible Belt for the UAW. And so I am surrounded by people who have UAW benefits, and currently their plans are managed through TruHearing. So in the area that I live in, I honestly don't know how you could practice if you were not a TruHearing partner, because so many people in the area have those benefits and work through TruHearing. But the patients are just really kind of overjoyed when they find out the cost of the hearing aids. But here is what your insurance benefit is. And, even if they don't come through a plan where the hearing aids are completely covered, when I explain to them the cost breakdown, and oftentimes when I'm showing them what technology is available in the price, I will just honestly say, I cannot buy this for that price. This is a great option for you. And they know that I'm honestly telling them that. So it works very well for us.
Great. Love to hear that. Michael, how about in your clinic?
So let's see. How has TruHearing made a difference for me and my business?
Yeah.
I don't really do much marketing anymore. I get a pretty steady flow of patients from TruHearing that keeps me busy and keeps things going. And and that takes a lot of effort and energy and focus to create the marketing and execute the marketing. So for me, it's a cost saver. It's a steady flow of referrals, and so for me, that's very valuable. And as far as pricing is concerned, I live 20 minutes from downtown Boston, where there are 10 hospitals that sell hearing aids for $6,500 for a pair. And when I can sell them for a third of that cost and still say that the level of quality is just as good, and demonstrate that to them, I think that's a winner. And I think that patients, as I mentioned in the previous question, they're very educated these days. So they know there's $6,000 pairs of hearing aids out there. And when I tell them it's a third of that they're very, very much put at ease. So I think that has enormous value. So
Yes. Yes.
Yeah, and I agree with both of them. I mean, it really sets us apart from maybe the ones that are not in network, that are not giving those people affordable, hearing aid solution. And two, I mean, I think when you think of the statistics of untreated hearing loss, and that's one of the biggest things is cost. I mean, that's what keep people not coming in for 7 to 10 years and waiting. They remember the $6,000 sets of hearing aids and the 8,000, or somebody who they knew bought an $8,000 set and had it in their drawer. Well, why am I going to go out and spend $8,000 if my friend Joe down the road had them in his drawer. So I think it helps, you feel like with TruHearing, having that being in network, it helps you feel like you're helping more people. You're providing more care. You're treating, taking away. I mean, 14.6 million people have untreated and disabling hearing loss in the US. And we are the solution. We are the solution to help these people, break through that stigma of cost. And TruHearing's allowing us to do that. It's allowing us to provide better care at a better price, and just overall just helping people and their families.
Very well said. All wonderful points. Thank you so much for sharing. On behalf of TruHearing, I'd like to thank each of you for participating in today's panel discussion. You represent 3 of more than 7,000 TruHearing provider locations nationwide, who are an integral part of the hearing care journey for those with hearing loss. As experts in the hearing healthcare industry and providers of the highest quality care and service, we appreciate you sharing your insights and experience with our viewers. I'd also like to thank our viewers. We hope you have gained a better understanding of hearing loss, the impact it can have on one's health and well-being, and that there are affordable hearing care solutions available through TruHearing and our partnerships. Thank you for joining us.